Welcome to Salad with a Side of Fries. I'm your host, Jen Trepic, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. This week, we're talking about black cohosh. Ever heard of it? So it's sometimes referred to as black bugbane, black snake root, fairy candle, macrotis, battleweed, or even rheumatism weed. So it's in nature, it is a perennial shrub-like plant which grows in the forests of eastern U.S. and Canada. And it might be a new botanical for your vocabulary, but it's certainly not new. Traditional Chinese medicine uses it to reduce musculoskeletal pain and spasms, to support liver function, to support the nervous system, and to tonify the kidney and uterus. North American indigenous populations turn to black cohosh for pain associated with periods and childbirth and menopause symptoms. So in recent times, we see most uses of black cohosh for pain and discomfort associated with gynecological symptoms or disorders. So it's somewhat unclear the exact mechanism of action with black cohosh. There's some research showing that it binds to our body's opioid receptors, which is how we see that pain-killing effect. There's other data which seems to say that triterpene glycosides are the active constituents in black cohosh, along with isoflavones, alkaloids, and phenolic acids. So in the body, black cohosh may have a similar effect as estrogen. Low estrogen levels are linked with a lot of the symptoms that are associated with menopause. So we see that connection. And we can think of black cohosh as having potential to support hormonal balance, right? I will say the only condition with research and evidence is that connection to relief from some of the menopause symptoms. So in a study published in 2018, they took 80 menopausal women experiencing hot flashes and gave them either black cohosh or evening primrose oil every day for 8 weeks. Those who supplemented with 20 milligrams of black cohosh reported significantly fewer and less severe hot flashes than before they started the supplement, and as compared to the participants who were given the evening primrose oil. There are other studies showing similar outcomes. I think it would be great to get some larger studies, some more studies in general. And I think, though, what we see here is that it's promising and potentially really helpful for women. With menopause's impact on mood, black cohosh may help there too. There was a review of some studies that looked at the use of herbal supplements for anxiety and depression in menopausal women. And they saw supplementing with black cohosh had no effect on anxiety, but it was linked to significant improvements in these psychological symptoms. We also often see sleep disturbance and weight gain with menopause. So on those fronts, black cohosh may also be helpful. So with the sleep, it doesn't necessarily improve sleep, but it may help reduce some of the symptoms that cause sleep disturbance, right? Or that interfere with our sleep, like hot flashes. So there was a study of 42 menopausal women that showed supplementing with black cohosh improved both sleep duration and sleep quality. So again, not knowing the exact mechanism, it seems like it could be that hot flash connection that helped improve the sleep. On the weight gain piece, at this time of life, weight gain is often connected to lower estrogen. So with the estrogen-like effect of black cohosh, it may have some beneficial effect on weight management in menopausal women. So this certainly needs more research. Like I said, larger studies, more studies, but it's interesting, especially given, what we talk about here at Salad with a Side of Fries all the time. Outside menopause conversations around women's health and hormone balance include conditions like PCOS, fibroids, PMS, and PMDD. By the way, that's premenstrual dysphoric disorder, menstrual cycle regulation, and fertility. So with all of these, there's less research than there is on the menopause piece of it. Of that list, the most substantiated use of black cohosh is connected to fertility. So research demonstrates that black cohosh may improve the effectiveness of fertility drugs. Specifically, there were studies with Clomid. So in people who struggle with fertility, taking Clomid and black cohosh seem to improve the outcome. So humans with infertility took black cohosh supplements along with Clomid and saw improved pregnancy rates or ovulation. It's this same research actually that also gets us to the claims around PCOS. So if a person with PCOS takes Clomid and black cohosh, they may increase their chances of getting pregnant. And then I think it's also interesting to note these same studies showed women with or without PCOS who are undergoing fertility treatments, black cohosh may help regulate their menstrual cycle. Now, with even less direct research is fibroids. So there was one study of 244 postmenopausal women who took 40 milligrams of black cohosh daily for 3 months. The conclusion said it may decrease the size of uterine fibroids by up to 30%. With PMS and PMDD symptom relief, the response to black cohosh is mostly anecdotal. We don't really have research there. I think when we look at the piece of the puzzle where black cohosh has potentially estrogenic activity, we want to think about more than just symptoms of PMS, menopause, and fertility, right? We mentioned the weight management piece of menopausal women earlier. And then cancer also seems to come up when we talk about estrogen. So there's no clear answer on the impact of black cohosh and breast cancer. We need more research. There are studies to show that there's some protective qualities. There was a study that kind of gave maybe reason for caution. In 2 human studies, taking black cohosh was associated with a decreased risk of breast cancer. In test tube studies, black cohosh extract exhibited anti-estrogen activity, helping potentially slow the spread of breast cancer cells. And then there was one study where it could potentially worsen breast cancer or increase the risk. So we need more research on this. I share it so that it is on your radar as we're talking about this botanical, or as you're maybe now going to start to hear it in other places. So maybe you're thinking you want to try black cohosh. Standard doses range from 20 milligrams to 120 milligrams daily, and it can be used safely for up to a year. So you'll see it available in tea, tinctures, and capsules. There's some argument that black cohosh in a formula with other nutrients and botanicals may be even more helpful. That's how I've seen it. Doctors that I work with who use it in their practice use black cohosh in a formula that has other things. I'll put a link to that one in the show notes for you. But I also did find online a way that you could make tea for yourself. So you brew it. So you simmer a cup of water with a 1/2 to 1 teaspoon of dried black cohosh root. Probably have to go to like a traditional Chinese medicine doctor or a place where you can find black cohosh root. So it's 1 cup of water with a 1/2 to 1 teaspoon of the dried black cohosh root. Keep it on the stove for like 10 to 15 minutes, then strain it and drink up to 3 cups per day. As with everything, please consult your healthcare provider and your pharmacist. Also, I always take note of potential side effects, even if they're mild. So with black cohosh root, you might notice digestive upset, nausea, skin rashes, potentially infection, muscle pain, breast pain or enlargement, maybe spotting or bleeding outside of your typical cycle. More severe reactions can affect the liver. So be aware of that if you have liver disease or you're taking other medications that may, or anything that may harm your liver. And discuss this with your pharmacist, because your pharmacist is usually the best person to advise on any potential interactions with anything you're taking. So all in, I think black cohosh may be super helpful for women and offer options, especially at a time when so many feel doomed. So there you have it, guys. My friends, the deal on black cohosh. So thank you again for Nina for joining us today. As always, everybody, I'm your host, Jen Trepeck. Connect with me on Instagram or all social media. I am at Jen Trepeck, JenNTrepeck. Please send a message. I love hearing your takeaways, your questions, any ideas you have for future episodes or nutrition nuggets. This is also the easiest way to learn more about working with me as your health coach and getting some of that personalized support. Of course, if you are not already a member, join our membership program to support this podcast and this community, but most importantly, support your health. You'll go to glow.fm/salad with a side of fries. You'll get this week's recipe for the healthier chicken apple sausage and Nina's course, Map to Body Peace. So until next week, remember, kindness toward yourself and your body may be the missing piece of your puzzle. Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.